Have you ever wondered what it takes to truly transform a patient's experience through innovation? Today I'm joined by two industry superstars, Dr. Jessilin Quint and Dr. Janelle Davison. Together we dive into the challenges and rewards of adopting new technology in eye care, how it can not only elevate patient satisfaction, but also reshape a practice. If you're looking for ways to set your practice apart and embrace change, this is an episode you won't want to miss. Hi, welcome to another episode of I Own a Business, where we focus on helping practice owners grow the practice of their dreams. I'm your host, Dr. Steve Vargo, and I have with me two superstars in the industry who you've probably seen or heard or read something that they've written. Dr. Jessilin Quint, who is co-owner of Smart Eye Care and Smart Eye and Med Spa in Maine, and Dr. Janelle Davison, who is owner and CEO of Brilliant Eyes Vision Center and the owner and clinical director of Visionary Dry Eye Institute, a referral and co-management center in Georgia. So hello to both of you.
Hi, Steve.
Hello.
Thanks for having us. Excited to be here. Always good to be here with Janelle too. She's
Yes.
fantastic.
Yeah,
J
Janelle's
and
been on
J.
the show before, so now we get Jesselyn. We get two superstars here at once. So I'm so grateful that you guys could join tonight. I think it's going to be a really interesting conversation. Technology and innovation are going to be at the center of what we're talking about, and more specific, the impact of introducing new technology in patient care. So there's both benefits and challenges to innovation in any small business, but both of you have not only embraced change, but you've seen firsthand how it can transform your practice. So if you don't mind, before we jump into the questions here, just for some background and context, if you don't mind telling us a little bit about your practices. And since we've got three of us on here, I'm going to go in alphabetical order, which means Dr. Janelle wins by a very small margin. So we'll start with her.
Well, thanks for having me, Steve. So, yes, as you stated, I'm in Georgia. I'm in Smyrna, about 10 minutes north of Metro Atlanta. I am the founder of Brilliant Eyes Vision Center, which I started cold in 2010. I've grown that practice and really developed a passion for dry eye. So 2018, I had a dry eye spa with inside my practice. And of recently, I've really grown that to now that's a standalone facility about 3 miles north of my current practice. So I use my practice as a referral source, plus other providers in the area refer, and I get a lot of self-referrals. I'm so excited to talk about innovation with my buddy and fellow rock star, Jessilin. So we're going to have fun.
Yeah, thanks, Janelle. And as you're saying this, if somebody wants to go back in the archive of podcasts, we actually did a podcast on Janelle's practice and how she's innovating in the practice and the dry eye specialty that she has in here in Georgia, not too far from me. So Dr. Jesselyn, how about you?
So I'm a little more north in Maine, but
You're way up there. We were just talking about that. There's no more north, I don't think.
I know some people think that it's in Canada, but it is in fact in the
I
United
had to
States.
look it up.
So I co-own a practice there called Smart Eye Care. We have three primary eye care locations. Primary eye care being you see everybody from a newborn to 100 plus years old. Lots of contact lenses, we have, opticals in each of our three primary eye care locations, but a ton of ocular disease. We treat a little bit, in Maine, you have to do a little bit of everything. I have a special interest in dry eye. And so a couple of years ago, we opened up kind of a separate center focused just on dry eye and then started kind of dabbling into aesthetics. So similar to Janelle with that regard. But it's been really fun. So at the end of the day, I love being able to treat patients. I love being a business owner. I'm very passionate about dry eye, and I love specialty contact lenses.
It's interesting. You both have an interest in dry eye and aesthetics. So this will be interesting, the crossover here. And obviously you've both had to become innovative. You've both had to innovate to be able to build that kind of practice. So we'll start there. I'm interested in what you guys have done with your practice, and we'll merge into some other areas like contact lenses in a little bit. But a lot of doctors, I would say it's some, and maybe a lot of doctors have this almost, if it's not broke philosophy, this if it's not broke approach to patient care. And that may be the case whether we're talking about diagnostic technology or therapeutics or contact lenses. And this can prevent them from introducing new technology to patients. And there had to be points in the journey of your practice where you had to make a decision. Are we going to keep doing the same thing that we've been doing, the same thing that other people are doing, or are we going to decide to step out and differentiate ourselves? So for doctors who fail to do that, who fail to innovate, what are some of the potential ramifications of this to both the patients and the practice?
I think in order to remain relevant and to continue to offer the highest quality of patient care, you have to be open to innovation. I mean, at some point, if you did, everything exactly how you've done it, you would like that would become really dated. And then there would get to a point that you wouldn't be treating patients with like standard of care for, their eye health. So I think that's part of it. But I think that in order to be relevant too, in order, especially if you're in a business, right, you have to keep growing. We know that change is the only constant. And by being open-minded to different innovations and of course vetted appropriately, right? Because just because it's new doesn't always mean it's great. But being at least open to it, I think definitely patient care, but I think even on a business side allows you to be competitive, right? To differentiate your practice, to attract employees, right? People want to be attached to an organization that's growing, that's thriving, that's exciting. And usually those descriptions come with a practice organization or a provider that is open to innovations.
Yeah, I totally agree. I believe wholeheartedly that innovation drives change. I have sometimes an opportunity to kind of work with some of my peers, and I always reflect on there's very few things that we do now that we did 20 years ago, right? When was the last time we had a landline? And so I always tell my colleagues that you have to be thinking ahead. Don't underestimate what change or innovation can do for your practice and your patients. And just because patients aren't saying something does not mean they're not interested in something new. And so don't be afraid to embrace change and innovation.
Jessilin, you mentioned something that change is the only constant, which is very true, but change is also very difficult. And I'm curious, as you were saying that and you were both talking, I can hear the motivation in your voice in wanting to make a change and wanting to innovate within the practice. But how do you get your team on board with that? Because we're not running a one-person show in these practices. And maybe part of a broader question is what prevents more doctors from presenting new technology? Some of the things I hear are that it's hard to get staff on board. There's maybe a few other things we can get into, but I'm curious on that aspect specifically.
Ooh, change and leading a team through change, whether it's a small change or a huge change, that's difficult, right? Like your book is an awesome resource, right? On kind of prescribing change to that. And there's a lot of great books and leadership development that is focused on that. So I feel like in general, that's something that I've invested a lot in. Because when I look back at when I became a very new business owner, my approach to leading a team through change, not that I have it all figured out because it's always changing, but I've definitely refined that skill set along the way. If I had to pick one thing that has really made a big impact, it's explaining the why. So sometimes as business owners, we make these challenging decisions all the time and then we kind of give marching orders, right? And sometimes when you're with change, you have to be sometimes really delicate and open to all these little nuances and different personalities, and people think differently and have different fears, right? Change can be really scary. And so you have to, there's definitely kind of a nuance to that. But the biggest thing that I found, whether it's introducing a new contact lens, bringing in a new dry eye technology, opening up a new location, I found that explaining the why, talk down and be like, hey, team, this is what we're thinking about. And these are the reasons why we think it's a good idea. And this is how we've thought about it. And these are the things that we considered. And sometimes, most of the people on our team they're good people, right? They want your team to succeed, but nobody wants the rug ripped out from under them. And so I think if you sit down and you're honest and you're transparent, but you explain the why, that can really just kind of connect the dots and make sense, or at least make it a little bit easier and kind of that first step of navigating through that process of change.
Yeah, and Janelle, before I ask for your answer on that, it's a lot of change management or change management, leadership, both of them are involved. But yeah, and getting people on board, I love that part about it maybe explaining the why. What's in it for everybody besides just the doctor? Because I think sometimes staff looks at things that we're trying to do and thinks, oh, that's just so the doctor can drive a little nicer car, make a little bit more money. But what's in it for the patient? What's in it for the practice? What's in it for the staff? I mean, what's in it for them?
So I definitely agree with Jessilin. Explaining the why to the team is totally important, but I'm very a process-oriented person. So I really take time to think about what technology I'm bringing into practice, whether it's contact lens related, whether it's virtual paperwork or a piece of equipment, what that journey is going to look like. So I really try to map out the patient journey from the front to the back, include everybody, including myself, meaning what is the responsibility for the front desk, the optician, technicians, all the way back to the doctor. And I try to make sure I really understand that process. Then I make sure I have it written down, and then I have a staff meeting, and then we go from there. I usually always make sure I work with my vendor partners to have training, but they like to have processes. Once they understand the why, and then they know step by step what we're doing, what to do when something's not working. And then I always have a plan to pivot if it doesn't work, right? So I definitely believe in giving time for things to work out the kinks, but I will pull the plug if I have to, if I see my process that I thought was going to be really great, that it's just not really working in real time. So having a plan works really good for me.
Yeah. And I think there's an element too of experimentation. I've really gotten interested in, as I do research on other companies and what they do to achieve success, how much success is due to something that I don't think we look at enough or pay as much attention to, is experimentation. It's amazing. I started to look at these different companies and industries, and some of them do it almost on accident. They just realized that over the years, here's all the mistakes we made, but they learned from it. But they said, well, we just tried a lot more things, to the point where there's a lot of companies now that actually have active experimentation within their companies, knowing, and here's the really interesting thing, 80% of their experiments fail. But it's learning from the 20% that continue, and they double down on the things that are working. So it's really got me interested in having more of almost a proactive approach toward trying new things and seeing what's working. We were talking about change in the staff, but what about change with patients? Because that can be hard too. When we introduce something new, patient comes in, they've got a vision plan, they just want a new pair of glasses, and we're trying to talk to them about some new therapeutic or some new diagnostic technology or some new contact lens. How do you frame that conversation with patients who might even be a little bit skeptical about what they're hearing?
So I guess I'll try this first. I usually try to make sure through their history or the reason for the exam, try to find a reason why I'm going to introduce change. If that happens, it makes it a lot easier for me. But at the same time, let's say everything's working great, whether it's old technology, let's just say it's a contact lens and it's an older contact lens. They don't necessarily have any issues and I don't necessarily see any problems. But I always like to tell patients when they're coming in for this once-a-year exam, this is the best time to see what's new, what's out there, what may be something that's working better than what you currently have. I always make sure that I incorporate how the world is changing, making sure we have constant UV protection, full UV protection. Are we protecting our eyes when we're on the computer? Are there contact glasses that help aid with it? So I really try to find something that be going on in their daily life that they explain through their exam and find a solution. And then if not, I always just let them know it's okay to try new things. If it doesn't work out, we already know what's kind of like our floor and what's working. We can go back. And then I like to use technology as a way to explain change. Cell phone is super easy. No, nobody has a flip phone. Even my 80-year-old parents, they don't have flip phones. They have iPhones. And so we just move with the times, And so there's always something that helps our world to be a little bit better. And it's no different with glasses and contact lenses.
That's true. I really like your piece because I think active listening is huge. When you can listen to a patient's problem, and then our job is really, we're making specific recommendations, right? We're kind of curating treatment plans, whether that's in the form of glasses, contact lenses, a dry eye treatment, myopia management, whatever it may be. And so, but that first starts with kind of listening to what the problems are, and then just explaining the why, kind of going back to that of why that specific innovation is going to solve their problem. I don't know about other practices, but sometimes in Maine, I feel like my patients are maybe a little more resistant to change than other parts of the country that I've lived. So that has been a little bit of navigating through that. But sometimes patients also just need to hear it, think about it, and then come back. So having had patients that maybe aren't as open initially, I still feel like I need to be proactive, which is, recommending that. Now they might not want to do it that day, and that's fine. They might go home, the next day and then call back, or sometimes even if it takes a little bit longer, I've had patients that then when they return a year from there, now they're like, all right, now I'm ready for that change. I'm glad you told me about it. But I think that we still have this obligation to be proactive and discuss those innovations with patients. A lot of our patients are waiting for us to bring it up, right? It's like I feel like docs are waiting on the patient to kind of make the statement that they want to try something different. But really at the end of the day, and there's a lot of surveys out there that show that patients are expecting the doctor to bring up those innovations. And so I feel like anytime a patient comes through my door every year, it is my job to tell them what I genuinely think is going to be best for them. And a lot of times that has to do with newer technology. So I think just at least talking about it with patients and having that proactive conversation. Maybe a patient's ready to try it right then, or maybe they need to go home and process it. We all, process change a little bit differently. But sometimes if you at least plant the seed, then that kind of gets the wheels in motion for hopefully down the road, the patient to be open to new innovation.
Yeah. And
I wanted
sometimes
to
it,
just piggyback.
oh, I'm sorry,
Oh,
Janelle.
sorry. Go ahead. No, I was going to say a great point where doctors can pull out here that it's okay because they may think that need to think about it in 1 year is rejection. And so a lot of times doctors may not say anything is their fear of rejection. So that's a really good point. That it's okay. At least you planted that seed and they'll come back next year. That's a great point.
I think it's a great point too, and I'm glad you brought it up as well because I wrote this little word down called jaded, and I think that's what happens with some doctors is they get a bit jaded when they're trying to introduce something new to patients and they hear no repeatedly, and it is a journey sometimes for people to make these decisions. So to Jessilin's phrase of planting the seed, that's what we do. But I think if you can do that effectively, then you will get more people that will at least give it thought. Maybe they go home and do some research. Maybe they talk to a friend and maybe they call you back 3 months later and say, yeah, I'd like to move forward with that. I would like to transition into contact lenses. But before we do that, since you both have an interest in specialty in dry eye and aesthetics, if we could just stay there just for a moment. If we could take it past the point of just planting a seed, that person calls you back and says, okay, yeah, I'm interested. And let's maybe for the moment just focus on your dry eye, which obviously you both invested a lot into that. What has that meant for your practice? And maybe we can target these answers toward those jaded doctors who are feeling a little bit rejected in trying to move new technology, in trying to get people's buy-in on new contact lenses, new technology, and new specialty. Can you just take us past that point, get us over the hill, and what does that look like for your practice in terms of patient satisfaction and in terms of the practice finances?
Well, I think if they do come back, right? So we're over the hump, they've thought about it, now they're on board, they want to go through with it. That's an additional revenue stream. We're not always in this for the money. It's in it because we really believe that that's going to help our patients. So that's already a win, right? Like we're doing something in the direction that's going to make their eyes better. But as being a business owner, you have to keep the doors open and money talks with that. So being able to then kind of open up those additional revenue streams is huge. I think too, I remember like looking back at our dry eye specifically, the first couple times I had pitched like a dry eye package, right? Where it was thousands of dollars. And you're not kind of rolling with the most confident straight at the gate. I remember having thoughts of like, what if my patient thinks this is too expensive? Like, are they am I gonna lose my credibility? Just all those internal mind games that you have. But then I just kind of got out of my own head and I, recommended what I genuinely thought. And the first couple ones, they had to go home and think about it because it was, kind of a big price. But then they came back in, we did the treatment, and then kind of the proof was in the pudding, right? That led to some referrals, but then that kind of grew my confidence. And then over time, I look back now and I feel like my pitch, right, which is really just my recommendation, has grown and it is much more effective, I think, because I went through all those jaded, kind of uncomfortable times.
Yeah, I agree. And even 5 years in, having my own standalone, it still happens, right? And so a lot of these technologies and these treatments are so new that patients need time to think about it. And so I don't necessarily count that as rejection. I make sure I'm confident in my diagnosis. I make sure they have the tools to think about it. All of my patients leave with a folder with complete treatment recommendations in there. Some of them I anticipate they're going to happen immediately. Some of them I'm thinking down the line. But I've had several patients two that I can think of that are in treatment now that I saw at the beginning of the year. At that time, either their finances weren't ready for it, or in their back of their mind, they're like, I'm gonna try one more thing, one more tier, and then they call back because eventually, dry eye is chronic, it's progressive, and if we're not attacking the underlying issue, they'll eventually come back. They'll come back, and then they feel like they trust you because they didn't feel pressured. They had all the information that they needed right in front of them, and they're in their treatment plans now, and we're improving their daily life function, the overall comfort of their eyes. So even 5 years in, even considering myself an expert, I still get those patients that need that time to think about that treatment plan. So do not consider it rejection. If you're confident in the diagnosis, give them all the tools, be there as a support system for them, and then they'll eventually come around. And when they come around, they'll come back around to you, and there'll be one loyal patient, and they'll bring their family members and friends.
Mhm.
I
I've
hear.
even had a few patients that they were, when we talked about why I thought this dry package was good, and then they didn't quite do it. It took them a couple years, but they went and told all their friends. So it was just, and then those friends came in to see me for a dry eye consultation, and they actually kind of went through the treatment plans. Like, I've had a handful of patients that when I look back from like a business perspective, the fact that I just proactively had the conversation, while it didn't necessarily immediately capture that one patient, the fact that it kind of like word of mouth revenue and spread awareness about it brought in more patients to the practice that did it. So when I think about just one conversation that led to, 3 to 4 other kind of, dry package purchases, like that was well worth having that conversation, even though initially that was a moment of being, not now, but later kind of rejection.
I hear that all the time when it comes to price. I think it's our own fear, maybe a little bit of insecurity on our end to be able to state that price. But I hear that all the time is just come up with a price that you think is a fair price for that service, quote the price, and then just shut up and let that sink in on the other side. And I've never heard of a patient passing out after hearing that. It usually nothing bad happens. It's not to say that you're going to that everybody's going to opt in for that product or that service, but I think you've just got to get that pitch down, like you said, Jessilin, work on it, tweak it, and be confident in what you're charging for it. The thing is, when those people do recommend others, the people they're recommending are going to know what the cost is. It's not going to be a factor because they're going to tell them. They're going to say, I paid this amount for it, but it is worth it. It is worth every dime. You need to go see this doctor. If we could take that mindset of trying to change people's mind or at least get their buy-in on something and pivot into contact lenses. We've been talking somewhat general about new technology, but I want to focus on something more specific, contact lenses. And you both, one of the reasons that we invited you on, were both innovators, part of an innovative group for a recently announced new innovation from Alcon, contact lenses called Precision 7. So can you briefly explain what Precision 7 is and what makes it different from other contact lens technologies that are currently available?
Yeah, so Precision 7 is an exciting new contact lens innovation. It's for the first time, it's a 1-week disposable, which I think Janelle and I could probably just, attest to. That has been very intuitive for our patients. So starting each week, every week with a fresh new lens, is just naturally really awesome. But the part that makes it stand out, and we'll get into some of the characteristics, is that it has this active flow system. And that's really what makes this a new innovation, what makes this contact lens really kind of stand out, and what makes it I think clinically perform how it does in a lot of the trials. So this active flow system. So with the Precision 7, we have this new high material, and at its core, there's this kind of permanently bound water loving moisturizing agent. But then through a proprietary replenishing agent, this moisture is kind of delivered, sustained delivery from the core to the surface. And so what that translates to clinically is comfort. And we all know with contact lenses, comfort is king. And so if we look at the data, and I know I certainly see this from having fit this contact lens, is that this contact lens is comfortable for like 16 hours. So most of our days don't end after 8 hours, right? Or 10 hours. Most of our days are longer than that. And so we need to be able to have a contact lens that can allow us to have not only great vision, but a really, great comfort throughout that time. This contact lens also has blue light filtering, which is awesome. So many of our patients are really thinking blue light is on their mind, which is with as much screen time that we have. So having that component is really helpful. Its DK over 10 is 149, so it's very highly breathable. It has that class 1 UV filtering component, which we've seen with other Alcon lenses, which is great. It's very easy to handle. Some of my patients have described it as it's as comfortable as a daily disposable contact lens, but its handability is similar to a monthly. So like for new patients who are putting a contact lens in, or for a patient that maybe has some dexterity issues or just has a hard time, being able to have kind of a modulus that's a little bit easier to handle is huge. It is FDA approved for 7 nights and 7 days of continuous wear. I haven't necessarily pitched that with my patients, but knowing that it's FDA approved for that provides me with a little bit of comfort for our patients who might be napping in a lens or sleeping a night or two in the lens. But I mean, take home message, a contact lens that you throw away once a week that has 16 hours of comfort, has this blue light filtering capability, and really at its core has this unique system, this active flow system is just, it's really exciting.
Definitely exciting. Yeah. And so just to piggyback on what you were saying, I fit somebody today and the handling, that DK over 10, that 149. One thing she was asking, if it's going to be a shorter replacement, it's going to be hard to handle. It's going to rip easily. And the first thing she noticed taking it out of the case, that it was super easily to handle and went on her eyes very well and very easily. So it's a very exciting time in the contact lens space.
Mm-hmm.
You both mentioned a lot of benefits of this lens, and it does sound like a very exciting, as we're talking about new technology for patients. Who would you consider the best candidates as you're going through this list of different benefits of this lens? And in the experience that you've had fitting these to date, is there any one quality that jumps out as most attractive? Like you caught my attention with 16 hours of comfort. I mean, is there something to help other doctors when they're fitting these? Sometimes when you come up with your quote unquote pitch, you find that just certain things seem to grab people's attention. Is there anything in particular about this lens that has seemed to be most effective?
So in my practice, first of all, daily lenses are still the go-to in my practice. So we're not really fitting this lens to replace or take any daily lens wearers out of and putting them into a weekly lens. But it helps me kind of complete the portfolio. My slogan now is 1 day, 1 week, 1 month. Studies have shown that there are still about 60% of patients in reusable lenses. So we're making progress, but there are patients that are still wearing contacts that they reuse and dispose of monthly or every 2 weeks. So right now I'm targeting my biweekly wearers because we know that's not necessarily the most intuitive wearing schedule. Most of my biweekly wearers, I ask them, when do you throw your contact lenses away? They always say, well, they're supposed to be 2 weeks. And I'll say, well, what are you doing? What are you doing? And most of the time they forget and they're stretching them using a month. But I don't want to take them out and put them in a monthly lens. So now I have an option where I can put them in a lens where they have some of that flexibility, but it's easier to remember to throw your lenses away once a week. So usually I'll say either pick your day, or for me, whatever day I fit them on is usually the day that I'll say, so every Thursday you'll throw your contact lens away. The 16-hour, as Jessilin mentioned, has been huge. I always jokingly tell my patients that, not to date myself, when we first got out of practice, we would tell our patients 10 to 12 hours. First it was like 8 to 10, then we saw 10 to 12. And 12 hours later, I literally just got home at 7 o'clock today, so nobody is home 12 hours later. So the contact lenses need to perform for the patient's workday. And so most of my patients in our fitting are my 2-week wearers and patients that are complaining that they have to take their contact lenses out at some point midday, or having to take them out when they get home and still have 4 hours of things they need to do at home, whether it's cooking, helping with homework, and they're stopping to take contact out. And so I vividly remember one of my patients that I first fit the contact lenses with, busy mom. She leaves the house early in the morning. She's ripping and running. She's going to work. She's doing practices. She gets home. She's cooking. And when I fit her with this contact, she said, Dr. Davison, I was able to get through my entire day right before bed, even though I'd say try to get them out an hour before, but my contacts didn't dry out, didn't bother me. I didn't have to think about my contacts. I didn't have to stop and put them in a case, put glasses on. So I think that 16-hour wear is going to really hit home with our patients, because our lives, unfortunately, are super busy, especially we have active kids. And then one other thing my patients really like is the blue light filtering properties. That is definitely a buzzword. Still a lot of data and research, whether it's good, whether it's bad. What patients like to hear that they're getting those added benefits in their contact lenses, that now that they're currently in their glasses, that they can feel comfortable when they're on those devices, when they're wearing their contact lenses.
I agree. Blue light has been huge. I was kind of surprised how many patients would really like grasp onto that part of it. But that is, you say that in their ears definitely kind of like perk up. I think for me, patients of thinking about like who's a good candidate, definitely those biweeklies. But I'm with Janelle that in my perfect world, I would want every patient to be in a daily disposable. I really believe that's the best option for every patient. But a lot of times the reality is that our patients sometimes can't afford that, right? Or usually it's kind of a handability. Those are usually the two things, aside from parameters, maybe that keep my patients out of daily disposables. And so being able to have something like Precision 7, that price point wise is very affordable. I feel like we're moving closer to like that daily disposable like stepstone. So a lot of my monthly wearers that didn't want to go into a daily disposable for usually price or handability, that's who I'm kind of leading with this. But then that biweekly, I think none of my patients remember every 2 weeks. It's an awkward amount of time. And even if you had a good lens, if it's not being worn compliantly, that's when we start to get into issues. So 1 week is just really intuitive. I love Janelle's yours, like pick a day of the week, right? Start every Monday, every Sunday, every week with a fresh new lens. Like that is really just easy to remember. It's also combined a lot of times with, we usually have so many weekly habits, right? Like usually once a week, people will meal prep or they'll do laundry or it's cleaning day or, whatever it is. So just being able to combine that already existing habit that's on a weekly basis with replacing and starting with a fresh new lens, it just makes it really seamless. And when patients, as I said, are compliant with contact lenses, then, then that's a win-win for everyone.
It is a much more intuitive wearing schedule because I remember asking people who were in a 2 week lens, how long do you wear your lenses for? And then there's that long pause and they're just looking at you like, what do you want to hear?
Yeah.
Because it's not 2 weeks. I don't
Right.
know what it is, but it's not 2 weeks. It's just a matter of, okay, how long is it? Be honest with me. So it is a very, it's much more intuitive that I hadn't even considered. But yeah, that weekly schedule. And there is no shortage of people, as you know, from having a dry eye aesthetic clinic, there's no shortage of people that have discomfort
Mhm.
and that have dryness and have things that prevent them from wearing contacts. That is probably one of the biggest pain points that we can resolve. Certainly you have other treatments for that as well within your dry eye clinics, but I think sometimes we neglect the basic things like putting them in a contact lens that's actually going to feel good in the evening. So there's no shortage of those patients out there.
Definitely. I remember when I myself first tried Precision 7. So background story of me, I've had LASIK, so I'm already dryness prone. Rosacea, like I'm the worst, like I have dry eye through and through, and I really can't tolerate any sort of contact lenses, even a really good daily disposable. Usually after, like it's a hard time for me to make it through kind of a full day of wearing it. So when Janelle and we were at this kind of kickoff event, and we got to try firsthand these contact lenses. So it was out of state. So I put the lenses in, felt comfortable. We left them in because we had to go through a couple different meetings. And then I flew home that night from, Texas back to Maine. And I forgot that the lenses were in there. I fell asleep with them on. And it wasn't until the next morning that I was like, do I still have these contact lenses in? Because I don't have much of a prescription. So the vision didn't tip it off. But that's when I was like, maybe there is something here. But then, being, one hand account is one thing, but being able to try it with patients really just, I feel like patients, they feel that comfort, they feel that difference in the lens, and really that kind of just goes back to the active flow system.
What do you
Yeah.
both talk to patients about contact lenses when you want to switch someone who's not really having a lot of problems with the contact lenses that they're in? And this sort of brings us full circle because we talked initially about some doctors get in this, if it's not broke, don't fix it. But there's a real problem with time management as well. And that's understandable. When you're in a very busy practice, it gets really easy to bounce from room to room and say, how are your contacts working out? Oh, they're okay. Okay. And then we just write up a prescription because it's quick and easy and it doesn't put us behind. It doesn't get the staff mad at us. But when you've got somebody who you see some whether it's clinical signs or maybe whether it's some mild subjective signs, but you really feel like they'd be better off in a different lens, whether that be daily or whether it be something like a Precision 7. I'm curious to hear from both of you. What does that conversation sound like?
I just did that today. I think you just need to be kind of very assertive, like we do for diagnosing and want somebody to come back for glaucoma testing. So I had a patient today, and this is a really cool story. So the patient today was actually a rep for a different company. So I guess she must have been impressed with the office. So she booked an appointment online, got her paperwork virtually, everything. She comes in, she's due for her annual, and she wasn't really having any problems. She was wearing a reusable that is FDA approved for wearing 90-day lenses. No issues, but I'm thinking in my head, I always go in the room and I have a plan, right? So if I know if they're a contact lens wearer and I have ways to set up to know, then I'm always walking in the room with a plan. So just like you play sports, you practice, you have a plan. So you have to practice your pitch and just kind of walk into the room with a plan. I have a plan with if the contacts are working great and the patient's not complaining, this is how I'm going to approach that, versus if I see an issue or if they're complaining, that makes it easier. In her case, she wasn't complaining. She was compliant with her contacts that she can sleep in, but it was an older contact lens or a legacy lens, a legacy Alcon lens. And so I said, hey, Courtney, looks great. You're sleeping in your contacts, but you're wearing an older brand. There's some new technology that's out there. One, this technology is still going to allow you to sleep in your contact lenses, but get this, you're going to replace it every week instead of 30 days. So you'll get a fresh lens once a week, but I'm not going to modify your behavior. Doesn't look like you have any issues. You want to sleep in your contact. This particular brand allows you to do that. In addition, you're going to get this class 1 UVA and B, as well as blue light filtering property. So the way I'm saying, you see my face is excited, and she's like, oh, wow. And I'm like, well, let's get through the exam. Let me get some things in. And then once I get everything in the computer, I'm going to go grab the diagnostic lens and you're going to put it on. Patients have loved it. The last couple of patients I switched from this legacy lens to this brand really enjoyed it, and I think you're going to do great too. Didn't take me long at all. I'm putting things in the EHR. I'm letting her know we're going to grab it. I'm going to get my team. She puts the contact lens on, and immediately she was like, oh my God, this is so much more comfortable. And so nothing was wrong with her contact. She wasn't complaining, but I wanted to introduce her to new technology. I was excited about it. So I passed that excitement on to her. I reassured her that if it wasn't going to work out, we can go back. I really knew it was going to work out. And then I got my team involved. And so she left. She actually got an annual supply of contacts. And so I think you just have to have a plan, just like with anything you do, and have a plan for when the patient is complaining versus when the patient is not. That way you can just build your confidence as you're going through your clinic day.
Absolutely. I think if you can invest in a little bit of staff training to have them help ask the questions in the right way or ask the right questions, like, for example, how long do you wear contact lenses? Is that long enough would be like the follow-up question. Is that long enough for your day? So just like that little tweak and kind of the history with my staff, we've done some training on that. So we've been able to kind of catch some of those before I even walk into the room. And that's really helped make it efficient. So a little bit of training has really kind of led to some time savings. But for those patients that are complaining, right, they're voicing their discomfort, poor vision, whatever it may be, those are like the low-hanging fruit. Like those are the ones that you can easily make a change. They're already open to it. They're telling you they have a problem. Sometimes the ones that are fine, right, the contentment of being fine are the ones that need a little bit of coaxing. So even if somebody isn't having any issues, if they are in an older technology, or I just generally believe they need to be in a different lens, I just say like, I think we should try this lens. I think it's going to be really good for you for XYZ reasons. And usually just by saying that, most of the time they're like, okay, I'll at least try it. Sometimes for some people, if you just say new technology, they're like, done, take my money. I want the best of the best all the time. But not every patient's like that. So for the ones that are a little bit more reserved, I think if you can just, identify, what you see, why you recommend it, just talk about it. But my like spiel to them is, especially for Precision 7, is like 30 seconds long or less. And so usually just after saying like, I think that we need to switch to this lens, it's going to be, you throw it away once a week. It's really easy to remember. It blocks out blue light, or filters blue light and filters UV protection, has 16 hours of comfort, and it's easy to handle, and it's at a price point that you're going to love. Let's go ahead and try it and see if you like it. Just that quick little sentence just is really easy. It's gotten so much that like once you start fitting like a couple, your staff knows what lenses you're going to recommend. And so then sometimes just when you get into your top lenses and your patient, my staff sometimes will hear kind of problems that a patient is having, and they'll be like, oh, I wonder if Dr. Quint's going to talk to you about this lens because of this problem and what this lens does. So it really, at the end of the day, is a team effort. And if you can invest in kind of taking a team approach, if that's a little bit of training or just, educating your staff on what that is, that does make it much more time efficient down the road. But pitching new innovation really doesn't take that long. You just have to be able to yourself know what the innovation is and feel comfortable with it, and then just initiate that conversation.
Yeah,
Or
and
put
I
the lens
I
on the
don't.
patient.
Oh, sorry, I stepped right over
I was
your.
gonna say, then put the lens on them. Put the lens on the patient.
Yeah.
I think that's the key. I mean, it's all just moving people toward getting the lens on them, because it sounds like once they've got the lens on, it sells itself. I don't think it has to take a long time. It's something that I do a little bit of speaking on how to more effectively communicate with patients. And one of the things I really stress, which is I think we have to unlearn this from school, because in school, what did they do? We came out, we spent half an hour in there talking to the patient. We'd come out and the doctor professor would say, did you ask this? Did you tell them about this? Did you go over these things? And they kept sending us back in. We get out of school, we got to unlearn that, because we're just confusing people when we do that. I understand why we did it in school, and it was probably the best way to learn. But once we get out into the real world, you mentioned 30 seconds or less. Yeah, if that's all it takes, if you can hit the highlights and just get them into a lens. And something that I've learned from almost a decade of consulting, which I like sharing with other people, one of the most common questions I get are, what are other doctors doing? And I came to realize one day, it hit me. People love to know what's working for other people. So the stories that you guys are sharing, don't hesitate to share those with other patients. And I would tell other doctors the same thing. Share stories in the office, because when you're saying, hey, you're the doctor, they trust you, but at the same time, they know you're trying to sell something. There's maybe a little ounce of skepticism deep down inside if the patient's really being honest. But when you're telling stories about other patients that you've treated and the success that they've had, and your enthusiasm is coming out in that, that's really powerful. And it cuts through all that skepticism. So I really appreciate both of you guys taking the time here this evening and sharing your stories on your practice and what you're doing, and giving us a lot to look forward to with this new Precision 7 lens.
Absolutely. Thanks for having us, Steve.
Thank you. It's
Thanks.
awesome.
Thank you to both of you. So, and we'll close out here. So thank you for listening. And if you enjoyed today's episode, please subscribe to our podcast wherever you're listening, leave a review, and share it with your friends and colleagues. You can follow us on Facebook, Instagram, and LinkedIn. And to learn more about iDoc, you can visit our website at idoc.net. That's idoc.net. And check out the links in our show notes and or for some helpful resources for your practice. So we'll see you next time, and keep dreaming big.